I'm Kate.
I'm John.
I'm Thomas.
I'm Ryan.
And I'm Phil.
And live from Irvine, it's Saturday night!
Saturday Night Live!
Thank you everyone. It is spectacular, being able to host Saturday Night Live. Now everyone probably knows me, for my contribution to cosmology, mathematics, and physics, but I am here to promote intraocular lenses, or IOLs for all those out there with those annoying, debilitating cataracts. Let us go on a little adventure into the eye. Light enters the cornea of the eye, and is focused by the lens onto the retina that transmits the images through the optic nerve to the brain, where they are interpreted as identifiable objects. The lens is mostly made up of water and proteins that are arranged in a precise way to allow light to pass through it. Cataracts, or clouding of the lens, blurs the vision and causes colors to be less vibrant. Over time, the clear lens will gain a brownish/yellowish color, which makes you look pretty dang ugly. Cataracts affect nearly 20.5 million Americans age 40 and older, causing over 2 million IOLs to be implanted every year. In fact, it is predicted that by year 2015, that the global market for IOLs is predicted to exceed $3.7 billion US dollars, proving that IOLs is definitely a growing market. However, getting a newly developed IOLs into the growing market, or approved by the U.S. Department of Food and Drug Administration, or FDA, isn't as easy as you may think. Depending on whether you are able to obtain a 510K for your product, or if it's necessary to obtain a pre-market approval, really determines how long it will take to get your product in the market. A 510K is adequate when the product is considered substantially equivalent to a device approved before May 28, 1976. If a 510K can't be filed, then it is necessary for a pre-market approval to be obtained, which requires adequate scientific evidence to assure that the device is safe and effective for its intended users. The 510K takes relatively 3 to 5 months to complete, while the pre-market approval can take up to years to obtain. Materials used for IOLs are PMMA, silicone, hydrophobic and hydrophilic acrylic. Acrylic and silicone are very biocompatible, but there are still issues that arise with IOLs. Opacification, or the formation of an opaque object, is the primary drawback or issue with IOLs. The equatorial lens epithelial cells, when disturbed, tend to migrate posteriorly and group up and form Schneck pearls. These pearls contribute to the formation of PCO, or posterior capsular opacification, which is the most common complication in the application of IOLs. Additionally, there are roughly 3 different types of lenses: monofocal, multifocal, and accommodating. Monofocal lenses will be explained later. Multifocal lenses have multiple planes of focus caused by different diffractive properties of the lens. Accommodating lenses actually attach to your muscles to emulate a natural lens. But I digress. I forgot why we were all here. I am Stephen Hawking. I'm on a wheelchair.
Hey, it's Alexander Wallace again, and I'm here at UCI because I got kicked out of UCLA. Also, I've been getting a lot of death threats, so I had to dye my hair black and change my major. So I'm a BME major now instead of poli-sci, and oh my gosh, BME is so much easier. And after exposure to various biotech companies in the intraocular lenses field, I have a few things to say. And again, I know I'm not the most politically correct or medically correct person, so don't take this personally, and I don't mean this towards any US companies, so you guys aren't the problem. The problem is these hordes of Asian companies like All Pro Intraocular Lens and Omni that distribute to our hospitals every year. And if you're going to distribute to the US, use American technology. Omni, a company based in India that produces a yellow square edge intraocular lens made from PMMA, a material known for its biocompatibility. The rigid PMMA used in this intraocular lens contains a less than 1% water and has a refractive index of 1.49. Impressive knowledge, I know. And now these yellow lenses that help reduce the amount of UV light and high energy blue visible light from entering your eye. That's great to help reduce long-term damage to your retina. The square edge of the lens helps to reduce lens epithelial cell migration, which helps reduce PCO. I have to mention that rigid PMMA intraocular lenses need to have large incisions in the eye due to the fact that the entire lens needs to be transported through the cut. Oh, I also forgot to mention that rigid PMMA intraocular lenses are the oldest design of intraocular lenses. In America, we don't use rigid PMMA intraocular lenses. Duh. So on to my next point. Allpro is a Chinese company that designs and distributes a foldable hydrophilic acrylic lens. These hydrophilic acrylic lenses are formed from a mixture of hydroxyethyl I'm still so blonde. Hydroxyethyl methacrylate and 2-ethoxy methacrylate with a water content of 21 to 26%. Now I just mentioned that the rigid PMMA lens needs a large incision, but inserted through an incision as small as 2.8 millimeters. These hydrophilic lenses tend to have a high surface biocompatibility due to a greater affinity for extracellular components. However, the hydrophilic surface leads to an optimal matrix for cell migration, and this leads to lens epithelial cells migrating and causing posterior capsular opacification. Both Omni and Allpro products have a single focal plane around 24 to 36 inches from the eye. From most studies, this distance is where most of life's activities are observed. However, this leads to less focus on objects at farther and shorter distances. I'm sure the Chinese companies are talking to each other like, oh, Ching Chong Ling Long monofocal, oh. But seriously guys, limiting clear vision to one plane is frustrating to patients. So now let's compare these two Asian companies to an American company, Alcon, and its FDA-approved product, Restore. Later, Phil Sub. Restore is a foldable, single-piece hydrophobic acrylic intraocular lens. Hydrophobic acrylic has a higher refractive index than both silicone and PMMA, and it results in a thinner lens. Also, hydrophobic acrylic is usually made from a mixture of acrylate and methacrylate, which also makes the device very flexible. However, this type of acrylic is more fragile and prone to dents, cracks, and scratches. Whatever. The hydrophobic design also allows for as little as possible interaction between the lens and the capsular bag, reducing PCO. The apodized diffraction design with 12 diffractive zones of Restore enables it to give superior close distance visual power compared to monofocal lenses. Even if you're not an Asian company, you shouldn't be manufacturing inferior intraocular lenses. Thank you for listening and have a nice day.
Hi, it's Vince from Crystallins. You may have seen me advertising some amazing products such as ShamWow and Slapjaw. But today I bring you a brand new product that'll knock your teeth in, just like I knocked the teeth off that hooker. Well, now I'm out of jail. Ugh. And I'm here to bring you a Crystallins, a new product from Bausch & Lomb that'll have you seeing crystal clear in no time. If you suffer from cataracts, presbyopia, or refractive lens disease, we've got a quick 30-40 minute procedure that will allow you to achieve natural focus of the eyes so you can get back to the things you love. Crystallins is a modified plate haptic square edge, high refractive index silicone accommodating intraocular lens. That's a mouthful. Complete with UV filter to protect your eyes from the sun. So it's like wearing sunglasses indoors, but without the douchiness. Douchiness gone. Silicone has low surface adhesion affinity due to extracellular components that inhibit posterior capsular opacification. So basically, PCO is promoted with silicone products, but with the square edge design of Crystallins, PCO formation is highly inhibited. Silicone's hydrophobicity also inhibits anterior capsular opacification. Additionally, silicone's very slippery surface when wet causes a higher degree of error when the lens unfolds in the capsular bag. Crystalline sells for $4,800 for one eye, but if you call now, we'll give you a surgery on the second eye for absolutely free. Never blindly walk across the street with oncoming traffic again. Just get the surgery and see better. And the procedure is simple. Watch. Let me show you guys in real time. Are you getting this, camera guy? It's so simple that we don't even need a scalpel. Give me this laptop. Alright, all you need to do is make a small incision. Watch, I can do it with one finger. So easy. Look at all this blood. There's so much blood. How many ShamWow? Alright, watch this, guys. I'm gonna do this in real time, alright? Alright, 1, 2, gone. All the blood is gone. It's like magic. Then insert the lens with the injector apparatus. See, it's that easy. It's for seeing near, it's for seeing far, it's for 20/20 vision. Don't just see better.
I've been using
Crystal lens.
crystal lens for over a year now, and I love it.
Wow, is that astrophysicist Stephen Hawking? Can I ask you a quick question, sir?
Yes, okay, go ahead.
Stephen Hawking, why is crystal lens the best intraocular lens?
Because I am a genius.
Not satisfied by all crystal lens has to offer? Try the hydrophobic acrylic rezoom multifocal intraocular lens from Abbott Medical Optics. The rezoom intraocular lens has a sleek biconvex design made of soft acrylic for a snug natural field. UV protection! Since 2005, the rezoom intraocular lens has been an option for visually challenged people since it received FDA approval. A bilateral test showed that rezoom multifocal intraocular lens can also increase your reading speed compared to other commercially available lenses. Come in for a quick surgery and add sharper distance vision to your everyday life. Not a fan of surgery? Don't be a chicken. Getting your rezoom intraocular lens into your eyes only requires local anesthesia, so you can be awake to watch your trained surgeon the whole time, and you won't feel a thing. It's easy as that. Incision, excision, vision, precision. Look at that girl over there. Are you following this camera guy? She's obviously had cataracts before. Let's see how she dealt with it. Ma'am, can I talk to you for a second? How have you dealt with your cataracts?
Resume.
Call to order your crystal lens or resume for 4800. Call 1-800-101-0101. Call now.
I want to thank you guys for an awesome Saturday night. I want to thank the cast of SNL, and I want to give a special thanks to the biomedical engineers who are constantly striving to create cutting-edge research on the improvement of IOL, with such advances as accommodating IOL, which allows patients to maintain accommodation despite removing the natural lens. This is possible because an accommodating lens moves in response to the eye muscle strain and either focus near, far away, or mid-range. Without accommodation, removing the eye's natural lens would hinder the ability to focus, and the patient would require glasses. In just the past year, these amazing people have been developing a liquid IOL that would restore close to full accommodation. Unlike the mechanical IOL, the liquid IOL is able to change shape and eye due to its flexible membrane. The device changes shape in response to a change in the refractive index due to an electric field created by the eye muscle spiral. As the device changes shape, it varies the power, which allows one to focus near or far. Give a round of applause to those BMEs. Lastly, I would like to thank me Stephen Hawking for being so smart. Have a great night.